My name's Dr. Lederman, and I'm here with...
Peter.
And Peter, why are you here today?
I'm here for arthritis in my ankle.
So you have pain in the ankle, right? You have a lot of pain.
Yes, sir.
But we met actually years ago.
Yes.
In fact, you've been coming here a long time.
Yes.
And in fact, you've been diagnosed, I think, in 2011 with leukemia.
Correct.
And can you tell us what kind of leukemia you had?
Chronic lymphocytic leukemia with P17 deletion, which is pretty aggressive, so I'm told.
And you want to talk about your work at all? What kind of work you do?
I'm an architect.
So you're an architect and you do high-end stuff in fancy neighborhoods in America, right?
Yes, sir.
You don't have to be modest. You're very successful, right? And you're very creative and you're very smart, right? And you came to us with this huge problem.
My spleen.
You had a spleen. And why did you have a spleen problem?
Because of the CLL.
And what was the CLL doing to your spleen?
It was enormously enlarging it.
Okay, and it was enormous because the whole spleen was filled up with leukemic cells, right?
Correct.
And it was so big that you even saw a surgeon who wanted to cut out your spleen, as I remember.
I've been scheduled several times to have a splenectomy.
Okay, so you've been seeing chemo doctors and blood doctors and surgeons, right?
Yes.
And you were suffering a lot from this big spleen.
No question.
And why were you suffering so much from this big spleen? It's called splenomegaly, by the way.
Okay, because it was very, very uncomfortable to have this huge thing in my left side, and I was told that that's just the way it was. They put me on a drug called Imbruvica, and after 15 years, the size of the spleen did not reduce that much.
Okay, so you're spending probably $200,000. Someone was spending probably $200,000 a year for
19 grand a month.
19 grand a month times 12 months is $250,000 a year. For
right.
How many years?
Since 2012.
So 2012 for I don't know how many years. So
$2 million.
Plus, $2 million plus.
Exactly.
You could buy a house in the Hamptons for that.
Not quite.
A garage.
Garage.
Okay. So you buy a garage, you spend $2 million, and you weren't better, right?
Worse.
You were worse. And so your tumor, you remember how big the spleen was, by the way?
I can't remember the number, but I could feel it. It was part of my morning routine. I would say, feel it, and it was there, and I'd go for a checkup with my oncologist, and she would check it, and she just looked away. And then I've been listening to you on the radio for years.
Okay, so you actually, the spleen was about 18 centimeters, right? It was the size of a melon.
I think it got larger than that.
Okay, so at one point it was 18 centimeters. Okay. Why did you cancel the surgery, by the way? Or did they cancel it on you?
Because I just decided that I would rather take my chances, and if I died, I died.
So you were like desperate. It's like a kamikaze almost.
Correct.
And then why did you come here?
I heard you on the radio.
But you never heard me talking about spleen so much, did you? Or did I?
I did once.
One time I spoke about spleen.
Yes, you did.
And what did I say on the radio?
And you said the spleen is a unique case because we could reduce the size drastically in a very short period of time.
Most likely, right?
Most likely.
Okay, so I told you that on the radio.
Right.
Did you ever tell your doctors, hey, Dr. Lederman says he can give radiosurgery to the
Yes.
spleen? And what did your doctors say?
Don't do it.
So these are experts in the treatment of leukemia, right?
Yes.
So theoretically, they should know everything about the treatment for leukemia, right?
And they knew nothing.
And what does that tell you about things?
That they get stuck in whatever their plan is. They don't deviate from it to the mistreatment of their patients, in my view.
Do you think the fact that they were getting $250,000 a year from a treatment that didn't work would tarnish their view?
Yeah, because I was paying a hefty percentage, and it's a lot of money.
It's a lot of money. So it was a lot of money. You think that could deviate their view about treatment options?
Absolutely.
And when you told them, hey, there's a possibility of having this treatment, they said what?
It's not a treatment that we're familiar with, and we suggest you not do it. As recently as whenever that last blood work was done about a week and a half ago.
Okay, so so let's talk about it. So you had this
treatment. I'm talking about it.
You had this treatment, what, about 2 years ago now?
What?
How long ago was our treatment?
A year ago.
So you decided to go with it, forget about what the doctor said,
right.
Give us a chance. Why did you have the trust in me to offer you treatment when your doctors were telling you?
Because as I say, I've listened to you. I work on the computer in an office with just me in it. So I have the radio on most of the time just to listen to 710 New York. And I've listened, you're on 3 or 4 times a day on Saturday and Sunday. And I've listened to your show, I don't know how many hundreds of times. And I keep on listening to like 007 and all these people. And so finally I said, what can I lose?
Okay. Okay, did you ask your doctors over there, what can you lose?
No, as a matter of fact, when I made the appointment, she asked me if I had made the appointment, and I lied and I said no.
Okay, so you were afraid of telling her the truth, actually.
Correct.
Because you were afraid it's going to interfere with your wonderful care over there.
I just don't want to hear any stuff from her.
Okay, so then you came.
Right.
We talked about all the options.
Correct.
And do you remember that day when we talked about it?
Yes.
And what do you remember that day?
I remember you were very clear about what the possibilities were, how long it would take, and I went ahead and did it.
And you remember we made a stereotactic frame, a fancy frame of your body.
Correct.
And we mapped it out.
Yes.
And then we sent thousands of beams in to hit the spleen.
Spleen.
The big spleen.
Right.
And what did it feel like to make the stereotactic frame and to have the treatment?
Totally painless. Nothing to it.
No side effects.
0.
No pain. Was there any claustrophobia?
No.
How did everyone treat you here?
Superbly.
By the way, am I paying you anything to make this
No.
statement?
No.
You're doing it because you want to help other people, right?
That's for sure.
Because there's probably other people who are being given advice by their doctors, and
I hear it all the time.
And their doctors are hiding options from them.
Correct.
And you probably hear me on the radio saying, why do chemo doctors hide radiosurgery? Why do surgeons hide radiosurgery? Why do they do that?
For the option for me, from I'm multiple oncologists in Florida and in here in New York told me that the splenectomy was the only thing that would happen. And my question to them was, what happens if I have the spleen removed and my cancer comes back? One guy, Dr.
Oh, you don't need names. We don't need names.
Okay, yeah. He said, you're dead.
Okay, so you're dead. So here you are now. You had the treatment, no
right.
side effects, correct? No. You had a few treatments, and then you went back.
Right.
And what happened to that spleen that you were feeling every day?
You can't feel it at all.
So why did it go away with our treatment and not with treatment trips in 2011? You've had almost 20 years of treatment.
That's exactly right.
And none of that treatment never worked.
0.
And you had a few treatments here and
7.
And
the spleen is to the point where I just said to your son that my last exam was just like a week ago. And she had me on the back of the treatment table, and she wanted me to pull up my knees, and she kept on shoving her hand in here trying to find the spleen, and she said, I can't believe it. And I said, well, I do. I told you exactly what I was going to do. And she literally waved me off like that.
After she realized the spleen was gone away.
Correct.
She waved you off, meaning what?
Right. She said it's probably the Imbruvica.
It worked finally after 20 years when it never worked before?
Suddenly.
Yeah. So what do you think about that?
I was pissed.
Success has many fathers.
Okay, doctor, listen, all I can tell you is this. I mean, I've heard in business BS stories with it exhausting anybody's imagination.
You deal with builders and architects and
subcontractors, workers,
concrete, customers, customers. So you can detect when you feel bullshit.
Correct.
And you felt this was total bullshit.
I know it is.
So you're going to go back to her again?
I'm scheduled. She wants to see me in September because, are you ready for this? She said, maybe we should discuss taking you off the Imbruvica.
Why are you still taking it now?
I haven't for the last month. $9,000 a month.
So why would you take something that doesn't work?
Correct. And then I said to her, she said, I'm thinking of taking you off the Imbruvica. And I said, okay, can you explain to me why? She said, well, the spleen we can't feel the spleen, and your blood work. She even called me the next day, personally called me, and said, your blood work is great. pause, unbelievable. 160 platelets versus, I've had a low of 50.
Okay, so your platelets have tripled.
Right.
Which means that what it means is that the spleen has shrunken down so much, they've got out of the spleen and back into circulation, and they can help you.
Correct.
Right. So, but she said she wanted to give you more of the same drug, and now she wants to stop it for months.
Correct.
So that doesn't.
She says she wants to stop it for 3-month cycles. So go off for 3 months, come back, and see if everything is okay.
But if she really thought it was that drug, then she wouldn't stop it. Right?
That's correct.
So it's a sign that it's all.
I think it's for 17 years of. It may have. I don't know whether it did anything at all. I'm still alive.
Well, maybe it didn't do anything for you.
Right.
So what's your message for people out there who are going to their doctor, they're getting a treatment, and often people are afraid to tell their doctor, hey, I want to see Dr. Lederman, right? A lot of
Precisely correct.
And why are they afraid?
And I will tell you why, because your treatment is competition for them, and I am convinced it's a dollar and cent issue.
And you were paying someone was paying $250,000 a year. Your bill here was probably pennies on the dollar.
I don't know what the bill.
Well, you know it was $50,000, right? It wasn't.
Right. I don't know.
There's a few pennies.
Right.
Okay, so you've done well. No side effects. Was everything that we told you true?
100%.
Did anyone harm you or mistreat you while you were here?
Not for a second.
Okay, and your recommendation for other people with cancers and leukemias?
After you see a conventional oncologist, you have nothing to lose. You make an appointment to go see Dr. Lederman. He will talk to you very directly, and you can decide whether you want to go ahead or not. But I am here to tell you that it works, and if you don't do it and you opt out for drugs, chemo. This guy wanted me to put on I can't think of the drug. And I subsequently find out that it was totally worthless for CLL with P17 deletion.
Well, your doctors are expert in that, right? They've given you drugs for nearly 20 years.
Right.
So anyway, let's move on.
Okay.
So you heard about you listened to our program, so you learned about arthritis.
Right. I listened to the fishmonger, said his left and right hip was killing him, and I said, that's for me.
Right. So
Then the piano player.
That was Steve. Steve worked with 900-pound tunas, and for 20 years he was having pain in the hip.
Okay, but he picks up 70-pound pieces.
Okay, well, he was doing it all his life. Okay, and what's he doing now?
He can't sleep on either side. Now he can.
And he's pain-free.
And he's pain-free.
And you talked about Ted with his hand in the fiddle, right?
The piano player.
Well, he's actually a fiddle player.
Oh, okay. That's the one that got me.
Why?
Because my dad was a piano player, and the poor guy had arthritis so bad that he would literally be walking around like this. And he went for making a hell of a living. He wasn't a concert pianist. He played bar mitzvahs and confirmations and stuff like that.
He knew where the money was. Okay, so now tell me your symptoms now.
My symptoms are my right ankle. Several years ago, I didn't fall. Nothing happened. It just started to, if I was walking down the street, it just felt as though my ankle was going to give out. And I would sit down on a park bench if one was available, and it seemed like it reset because I would stand up and I'd be able to walk again, but not that far. So I've just learned to hide it. I can't do it in front of my clients. I can't be on jobs sitting in the car.
But it's getting worse and worse.
It's getting worse and worse.
And you don't want to have injections or surgery. Have you seen rheumatologists and orthopedic doctors?
I have been to orthopedics, and they want to do surgery.
Do you want that?
It's out of the question. I'm not going to do it. I mean, I've been lucky enough to live this long. I'm not taking any chances with surgery. My sister was a nurse at Mount Sinai for 43 years. She says, and she worked for a fancy surgeon. She says, you never let anybody take a knife to you unless it is absolutely necessary.
I have a question.
What?
Was he fancier than me?
Dr. Goldman. He was a nice guy. He left her some money.
Okay, so you're here with the arthritis.
Right.
And you've had no relief for years, and you've seen specialists in the field.
Yes.
And they haven't been able to help you.
Right.
Have you tried medicines or physical therapy?
Yes, I have. The last guy I went to prescribed meloxicam, and he said, just try to live with it.
Have you had any injections?
I had, what is that when they take your
Stem cell?
no, not stem cell. What is that? That's it.
PRP?
Yes.
Uh-huh.
Worthless.
Okay, and you took medicines, you had PRP, you offered surgery, you're not fat, so you can't do weight reduction, right? Some people are
Right.
overweight, but you're not overweight.
Right. Or they prescribe physical therapy. I went for physical therapy a couple of times, and this guy, nice guy, comes in and he says, for what you have here, you could be in physical therapy for the rest of your life.
Sounds great. For him.
It's not going to do anything, he said.
Well, it sounds great for him.
Oh, okay.
Just like your chemo for your...
Oh, no, she really is.
So anyway, you're here today.
Right.
And we have some relations of trust because we've been through this for some time now.
Yes, sir.
And we know that there's about an 80% chance of getting better.
Correct.
And we don't anticipate any side effects during your treatment.
No.
And we're going to make a mold of your body and treat that. And then we're going to do another video after this is done sometime in the future and talk about this also.
Good. I'll be more than happy to. Because I can tell you, I am literally in disbelief.
About the spleen?
About the spleen.
Okay, well, thank God.
It is literally normal.
Praise the Lord and pass the ammunition.
Okay.
All right.
I don't like guns.
Okay, if you're in a foxhole over there, in
Okay.
Iran, you might like
In Iran.
You might like some guns. So anyway, what if your gun is a radiation beam?
Use it.
And we did.
That's exactly right.
Any other parting words before we move on to greener pastures?
As I said before, if you are going to an oncologist and he is suggesting chemotherapy,
He or she.
Suggesting surgery or chemotherapy, tell him you want to go, you have to take a break and go to lunch. Call Dr. Lederman and at least listen to what he has to say.
And if you tell your doctor you're going to go see Dr. Lederman, would you advise that, or would you just pick up the phone on your own? And
Pick up the phone and do it on your own, because you don't want to listen to the nonsense and them trying to dissuade you from going to see not just specifically Dr. Lederman, although that may be true, but anybody besides them, because you're taking away business.
Pretty sad, right?
Of course it is. It's people's lives.
People's lives. All right, thank you so much.
You're welcome, sir.
God bless you.
Thank
and,
you.
We look forward to treating your arthritis, and hopefully that will work as well.
Thank you, sir, very much.
God bless you.
Yep, God bless you.